confirm that he or she can hear me. So I won't be speaking to myself.
Yes, we can.
Oh, that's fine. Thank you. Thank you. All right. So today we'll be discussing, we're looking at reading part A. So before we start, I just want to lay some foundations regarding reading part A. So in your OET, for your OET has 4 parts: speaking, listening, writing, and reading, right? These are the parts, the 4 components that you'll be tested on your test day, okay, to see your proficiency in these areas. So the reading part, reading subtest has 3 parts: the part A, part B, and part C. Now, as it progresses, it gets difficult. And most of you may be thinking that reading part A is the most difficult part to actually pass regarding OET subtest, reading part subtest. And I want to tell you that it's no. Why? Because I'm going to share with you tips tonight. By the time I'm done with this class, you understand how to navigate through and how to get your 20 correct answers in 15 minutes. Now, you also realize that you have, out of the reading part A, B, and C, reading part A has 20 questions, okay, allotted to it. That simply means that almost half of the questions comes from reading part A, while reading part B and C has only 22 questions. Then you also realize that you have 15 minutes to answer 20 questions. Now, this is a catch. The catch is that our work, it's designed not for you to fail, but for you to attend to your patients as a health professional in case of emergency. So that's why it's designed that way. And all you need to do to develop this skill, okay, is just to know how to skim through. So reading part A, please don't think that you'll be going to read and understand. Just know that all you need to develop is your skimming skills. So so today I'm walking us through those tips, okay, reading tips that we can use to find answers during our reading OET subtest. It's very simple. I'm going to share with you the tips for reading part A in this class. And then the first thing you must develop, like I said, is what your skimming skills. So you must engage in one's skimming practice a lot, because by the time you develop this skill over time, before your test date, you'll be ready for these exams. And by the time you apply all these tips I'm going to share with you in this class, I promise you that initially you might have having difficulties finishing answering 20 questions in 15 minutes. At some point, you had difficulties answering 20 questions, maybe we used to finish in 20 minutes before. But by the time we are done, you realize how to go about it. All right. So the first thing that you must note on your test dates is to quickly know what just quickly work out what the text is all about, right? So the first thing I'm going to look at what is, number one, once you're given your reading part A booklet, on that you'll be given 2 booklets. One will carry your questions, okay, and that booklet will carry your text A, B, C, and D in one booklet. Now the question, we have your question booklet, you are meant to supply or meant to provide answers, okay, on that same question booklet. So you can keep this booklet side by side. When you are skimming through on your left or reading through on your left, you also watch, you're providing answers on the booklet on your right, right? So the first thing is for you to work out what the text is about. What do I mean by this? For example, on your test there, if you may be talking about, let's say meningitis, okay? So if on your test date, okay, the main text talks about what? The header talks about meningitis. What that simply means is that your text A might talk about the definition of meningitis. B might talk about, for example, might talk about the clinical features of meningitis. C might talk about complications of meningitis, and D might talk about the treatment of meningitis. But however it goes, always know that it's always in this format. There always be clinical features, there always be drugs. Okay, treatment depends on how it is. So it's just the text talk about a particular disease condition. Okay, just know that you have to just limit your mind to the disease at hand that will be discussed, or you have on your reading parts A booklet. Now, the next thing is for you to look at what, when you're looking through, I'll show you how to skim through. You have to look through your text A, B, C, and D. I'll tell you how to go about it. But the thing that you must also note, okay, when you are skimming through, is for you have to look out for any graphic elements, right? Now, if you see tables, take notes of tables, take note of graphs, okay? You also have to take note of footnotes, as well as bullet points and numerical information provided on your reading text. Now, another thing that you also have to be very careful of, okay, that is, you must also look at headers or subheaders. Please, this is very important. When we will be walking you through, the reading text, I will show you what I mean by looking at the headers and subheaders, because the subheaders give information about the paragraph, so that when you're trying to look for your answers, you realize that we are not going to read these paragraphs, okay? But we are just going to go and find answers, and I'll show you how to go about it. So you know how to look out for what your subheaders, how to get your answers. Now, the next important thing you must be very careful of, and one tip that you must apply, okay, is to ensure that when you are given that 15 minutes, please do not write in capital letter on your notes. Do not attempt to answer the questions without going through text A, B, C, and D. Please do not. Otherwise, if you try that, you'll be going back and forth, and you realize that 25 minutes is not enough for you to answer that 15 questions. Now, so what do we do, or what do you do when you are given 15 minutes? Now, you have to use the first 1 minute, okay? Divide the first 1 minute into 4, that's 15 seconds each, okay? To what? To run your eye quickly down the text, okay? Please note, you are not aiming at reading or picking every word. Please note, save that energy of reading to understand for your part B and C. It will be required of you when you get there. But all you need to do is to spend the first 15 seconds and go through your text A. Second 15 seconds, go through your text B. Third 15 seconds, go to your text C. And your fourth 15 seconds, go through your text D, making you 1 minute before you attempt answering the questions. Now, I'll show you how to run your eye through. Running your eye through is what we call skimming, right? So you skim through your text A, 15 seconds, text B, 15 seconds, text C, 15 seconds, just to have an idea what text A, B, C, and D are all about, right? Now, the next thing you also have to look at for, you have to figure out what the text seems to be about. That's another thing. After just running your eye through this text A, B, C, and D, just figure out, okay, what does text A talks about? Okay, text A talks about definition, also talk about epidemiology or disease distribution. For example, you can say, okay, text B talks about drug treatment. For example, what does text C talk about, right? And what does text D talk about? By the time you note this, and you then start to answer your 20 questions, right? You realize that you will be done in less than even 15 minutes. Okay, so now this is how to go about it. If you see, we can see my screen now. For example, we have here today necrotizing fasciitis. So this simply means our header is what? Necrotizing fasciitis, and this is what is our text A. Now, this is the way to read it. Please do not start from these points. We know that not normally and naturally we read from 1 point on the left to 1 point on the right, except Arabic, right? Please do not attempt to read from 1 point on your left to 1 point on your right. This is wrong. If you try this, you're going to waste so much time. If you try this, you're not going to finish answering those 20 questions in 15 minutes. If you try this, you won't have the best outcome, and you might not be able to complete all your 20 answers, provide us 20 answers in 15 minutes. Okay, so now the next thing to do is this how to go about it. You have to read it in a zigzag manner from 1 point on your left to 1 point on your right. I'm going to walk you through it. So the first word that we see here is what? Is necrotizing fasciitis. What this entails is that text A talks about necrotizing fasciitis. So if the first word we are seeing here is necrotizing fasciitis, okay, this gives us a pointer that text A talks about necrotizing fasciitis. It might be definition, it might be anything, right? Now, the next thing that we are looking at is what? We move to the next line below it, and we read perineum, comma, the abdominal wall, right? We are done with that. Now, next thing that we see here is the mortality rate is high. The mortality rate. Here talks about what? Mortality rate. Now, next thing we can see is what? Microbiological findings, depending on microbiological findings. Now, we can see a table. Please be very careful when you get to see a table. Like I said, look out for tables, footnotes, numerical information, and graphs, okay? Now, we can see a table. What does the table talks about? The table talks about classification of pathogens, right? Classification of pathogens. Right, these are where pathogens are classified. Now, next thing that we look out for what are the distinct components of the table? We can see microbiological type. I'll just quickly see pathogen, site of infection, comorbidities, if you just want to look up. But then this we are still going to read in a zigzag manner. Let me clean this up. So you can run your eye across like this, but then we are still going to read it in a zigzag manner. So we can see microbiological type. We can see under pathogens, we can see obligate and facultative anaerobes, right? Now we can as well see limbs, site of infection, limbs. It looks like they are listing body parts. And we can as well see trauma, seafood consumption for aeromonas, right? And I just highlighted. Coming back here, we can see limbs and trunk again. And also forget that we can see, when we are looking at microbiological type, like numerical information, I can see run my eye through like this in this format. And I can see type 1, type 2, and type 3. 15 seconds, I'm done. As fast as I can. As do this in my first 15 seconds, I'm left with what? My second 15 seconds, I look at this. Let me talk about what? Antibiotic treatment for NF. Antibiotic treatment for NF. So the first word I'm seeing here is what? Antibiotic treatment for NF. What this means is that this particular text we talks about what? Antibiotic treatment for necrotizing fasciitis. Okay, so without even thinking twice, I just know that my text B talks about what? Antibiotic treatment, okay, for necrotizing fasciitis. And I can say type 1, okay, type 1 should be, so like type 1, maybe the antibiotics I have to use for type 1, antibiotics for type 2, type 3, and type 4. But I still spend my 15 seconds here. So I can see initial treatment, okay, for type 1 includes what? Ampicillin, right? Or ampicillin sulbactam. Then I can see gram-negative coverage is necessary. So I can see this gram-negative coverage, right? So if at all I find in future to refer to gram-negative coverage, let me just highlight this again. I don't know why my pen, my ink is not really good. I don't know. So what I said here is first thing is what? First thing is what? Antibiotic treatment, like I said. Okay. Next thing is what? Initial treatment includes ampicillin. Now I can see gram-negative coverage. All right. Another thing I can see is what can I see here that makes sense? Treated with antibiotics. This talks about antibiotics. Just move, okay? I can see hyperacillin and tazobactam. Okay. Very quick. Can see carbapenems, right? Here. I use at higher dosage. Can see that, just underline this, and I'm done. So in the second, for type 2, I can see first or second generation cephalosporin for type 2. I can also see an organic pathogen mentioned here, which was Staphylococcus aureus, right? Mentioned here. And as well, I can see daptomycin and lineazoid, right? I can see that here. Next thing, I can see my type 3 coming back here. can see, if you come back to my left, okay, in this line, I can see staph aureus is resistance to vancomycin, right? And in my type 3, I can see NF should be managed with clindamycin, right? That's like what should be used to treat what type 3. Then I can see the early use of tetracyclines. I can see crucial for the survival of the patient. I can as well see reduce the mortality rate. That's twice that we have come across the word mortality rate, right? Now, type 4, I can see can be treated with amphotericin B. Next thing I'm seeing here, I can see 5 days after local signs, symptoms. I can as well see another word here. I can see antibiotic therapy NF is 4 to 6 weeks. I'm done. So I've highlighted the keywords I'm coming across in a zigzag manner from one point on your left to one point on your right to another point on your left in a zigzag manner. And then I move to my next text. Now, this is text C. What's the opening statement or the opening sentence in text C? I'll just see here, supportive care in an ICU. What this entails is that wherever you're going to come back to look for what should be done for a patient, okay, in an ICU, you should come to your text C. All right. Now, we are done with that. So your text C, the first paragraph in text C talks about supportive care in ICU. So you're looking for any question that is requesting for what should be done for the patient, okay, who are managing for NF in ICU. I'll pick my answer as text C. That's where I can find it. So that's the way to go about it. Now, the next thing I'm seeing here, I can see wound care, aggressive wound care, right? Aggressive wound care. That simply means that if I'm being asked later on, okay, in terms of questions regarding wound care, I know that I'm coming back to where types A might take C. I can as well see caloric intake to combat infection. I can as well see intravenous hyperalimentation. As well, I can see prompt and, let me say, okay, I can see prompt and aggressive support, right? Okay, coming back here, I can see lower complication rates. Okay, that makes sense to me. I can as well see transferring blood urea nitrogen, and as well I can see receiving adequate nutrition. Right. I've seen caloric intake before, and now see nutrition here in my text C. Now look at the second paragraph in text C. What is the opening statement? It talks about wound care, right? So wound care, again, we highlighted wound care somewhere up there after we highlighted supportive care in ICU. So any question regarding wound care, I'm coming to my text C. The another thing I can see the dressings to promote granulation. So I can see the dressings to promote granulations. I saw about that. I need to take the call. Okay, so the next thing that we are going to look at is prepare the wound for grafting, right? Another thing we can also see is vacuum assisted closure. Okay, vacuum assisted closure, I can see it in patients whose cardiac status was precarious. Whose cardiac status, I can see surgical reconstructions operation. As well, I can see the VAC was thought to aid in local management. All right, so we can see that now my text C, my text D, we just move to text Z at once. No, the opening statement in text Z talks about what advice to give the patients before discharge. So advice to give the patient before discharge, right? So I just underline advice to give the patient before discharge. Now, the next thing I'm seeing here is what? Help arrange the patient after care. Okay, we are seeing a question talk about what advice should we give the patient after discharge, and I'm going back here. And what I should help the patient do in terms of after care sounds like when the patient leaves the hospital, right? Now, next thing now, next thing now I'm doing is to look at social services to promote adjustment, right? I can as well see physical therapy to rebuild strength. Next thing I'm seeing here is optimal physical health. Now, another part I can see the life-threatening nature of NF, right? Next thing I'm seeing is alter the patient attitude and viewpoint. Then I can as well see holistic approach when dealing with patients and family. I'm good. Now, the next part of this, I can see remind diabetic patients. Can you see this now? They're mentioning what is this condition, diabetic patients. Now, they're linking diabetes with what? Glutathione fasciitis. Now, I can see control blood glucose levels. Can as well see use and not reuse needles, right? Can as well see testing or insulin injection, and I can as well see someone's mic is on. Sorry, someone's mic is on. Who's that? Hello.
I told you now that I'm doing nice.
Someone's mic is on. Wait a minute. Can I see the looking for a person? I can't find a person here. So please, thank you so much for putting on the mic. Thank you. Okay, so I can as well see alcohol pads. Alcohol pads. Now, this is what you do in your first 1 minute, like I said, 15 seconds each. So by the time I get to my text Z, I've completed my 1 minute. So I have a general idea, okay, what my text A is about, text B is about, text C is about, and text Z is about. Now, if you also notice this, we have not read any of these texts, okay? We just have an idea of what the texts are about, right? And we have skimmed through and underlined some keywords, okay, in a zigzag manner. Now, let's see whether this strategy is going to work, okay? Let's see whether this skill is going to work. Okay, let's apply it now to our questions. Now, I love it. It's going to be an interactive session, so I love every one of us to open our mic, but then please can just control the noise from the background and while we go through all this together. So from question 1 to 7, instruction says for each question 1 to 7, decide which text A, B, C, or D the information comes from. You may use any letter more than once, right? Now say, in which text can you find information about, number 1 says drug treatment required. So in which text can we find information about drug treatment required? Somebody said what? Is it D or B? So someone said B.
B.
All right, thank you. So that's correct. You can see now how simple it is. Like I said, B talks about the opening statement was what, or the opening words, the subheader in B was what? Antibiotic treatment for NF. Antibiotics are medication. Antibiotics considered as a drug. So your answer automatically is B without you thinking twice. So here your answer is B. Now, number 2 says, which part of the body can be affected? Which parts of the body can be affected? Someone is giving me answer as A, so let's confirm whether it is truly A. So let's go through D. D doesn't talk about a part of the body. D talks about what? Advice to give a patient before being discharged. C talks about what? Supportive care in ICU, talks about wound care, dressings, and etc. Now, B talks about antibiotics. Somebody says A. Can we see, do we have any way body parts were listed in text A? Yes, if you take a look at this, okay, you see site of infection, right? You can see on this table, you can see the body parts are listed here: trunk and perineum, limbs, limb, trunk and perineum, limbs, trunk and perineum. So the answer is what? Text A. So you come back here. Remember that day on your test day, you'll be given two booklets. You won't be going back and forth like this. So by the time you just look at your text A, provide the answer on your answer booklets, okay, or question answer booklets on your right. You keep them side by side and just provide those answers. So is what is A. Now, 3 talks about the various ways calories can be introduced. Remember that we what underline the word calories. The various ways calories can be introduced. Where do you think we can find that?
C.
Somebody said text C. So let's go look at it. Okay. Text C. Text C. Did we at any point underline the word calories when we were skimming through? Let's confirm whether our strategy is working. Now you can as well see that after we underline, let me change my. Let me use a lesser pointer. So after we underline sportive K and ICU, we underline word wound K, and the next thing that we underline when we're skimming through was caloric intake to combat infection. Have you seen that? So automatically we are not thinking again, it is text C that is the answer. So you come back here, sorry. So you come back here and provide your number as what? C, right? D talks about who to contact to help the patients after they leave the hospital. Who to contact to help the patient after they leave the hospital. So which of the text talks about after care and discharge? After they leave the hospital, you must be able to what paraphrase these words, okay, in your head so that you can be fast about it. So now he talks about what advice to give a patient before discharge, okay? Now the question is who to contact, right? You can see help patients, you can see this minus that we in addition to the fact that we underline advice to give the patient, you can as well see that we also underline what help arrange the patient's after care, right? So just come back here and provide the answer as D. Now, next thing you are seeing here is what kind of dressing to use, right? Dressing. Where do we use dressings? Should more like what wound, right?
Yeah.
Okay, so we're coming back to where text C talks about what wound dressings. Also realize that see what we did here, that when we will talk about wound, right? If you look at this very well, just check this point. You can see after we underlining wound K, we also underline these dressings promote granulation. So you don't have to think twice. It's text C. So just come back here and provide the answer as what? As C. Now, number 6 say how long to give drug therapy to the patient. How long to give drug therapy to the patient? Which text talks about drugs again, please?
B.
B, exactly. So this is another way for you to confirm, okay, whether you, by the first time you picked your answer was correct, right? So without even thinking twice, okay, you can see that number 1 talked about drug before. Okay, number 1 question talked about drug before. And then number 6 also talks about drug. You see that? Now, if your answer to number 1 is B, it is expected that your answer to number 6 should be B, right? But then, okay, always confirm, please, so that had it been you have missed your number 1, and by the time you have gone to 6, you got it correctly, you can go back and correct your number 1 to be B. Does that make sense? So let's go back now and check. Coming back here, you can see still again what? Antibiotic treatment for NF. So the answer is what? Is B, okay? Telling us that what we were correct with our number 1 answer. Now, number 7 says advice to give the patient regarding needle use. Remember the word, look at the key word to what? Advice, right? Where did we see the word advice before? Can somebody get me the answer, please?
D.
Okay, the opening word here is what? Advice, right? Since D. Regarding what? Needle use, right? Now, can you also see that when we talk about the minor diabetic patients, so we underline control blood glucose levels, also underline use and not to reuse needles. Can you see this? If you agree with me, we have gotten 7 answers correctly without reading these passages, reading this text, right? So this is just the way to go about it. So this one is what? This is D.
D.
Exactly. D. Thank you. So this is D. Now, next thing we are going to look at is what? Is questions 8 to 14. Okay, so the same thing applies. So 8 to 14. 8 to 14 is complete each of these sentences, okay, with a word or short phrase for each of the text. Each answer may include words, numbers, or both, right? So now we are looking at what words to complete these sentences with a short phrase. So number 8 says, which 2 drugs can you use to treat Clostridium species of pathogens? Remember again, we are talking about drugs.
Go to test B.
Test B.
Okay,
Let's go
so
to B.
so we are going back to text B, exactly.
Yeah.
But then the key word we are looking for is what? We are looking for the pathogen, Clostridium species,
Clostridium
right?
species.
So we are going to go back to text B and search for Clostridium species. When we see Clostridium species, we will read the entire sentence that contains Clostridium species to know whether 2 drugs, okay, have been mentioned. So we are going back to our text B, looking for the word Clostridium species.
Is in type 3.
Okay, somebody has seen in type 3, so let's read type 3. Okay, I can see that's true. She's correct. So I can as well see Clostridium species here. All right. So whenever you see your keyword, please read the entire sentence like I said. So NF should be managed with clindamycin and penicillin. That's 2 drugs, right? Which kill the Clostridium species. So the answer here is what? Answer here is clindamycin and penicillin. That's the answer for number 8. Just come back here, provide your answer here. Now, number 9 says, which common metabolic condition may occur with NF? Now, I'd like us to think outside the box. Which common metabolic condition? Remember that at some point, I told us that there was a disease that they linked with what NF,
Yeah.
right?
Yes.
So which common metabolic condition have they mentioned in this text?
Diabetes mellitus.
Somebody said, that was diabetes, right?
Diabetes mellitus.
Okay, diabetes mellitus. Let's confirm. Okay, somebody said in text. Okay, somebody says
comorbidities.
Okay, you can see that. That's correct. You can see this here. So diabetes mellitus, okay? To just show you what that we and that's so there's always one question, there's always like out of this world that you must look for that day. So in this case, it is the diabetes mellitus, right? On your test date. All right, so the answer is what? Diabetes mellitus. I think we saw that again where that was remind the diabetic patient. You saw it here again. Remind the diabetic patient. Yes. Right. Remind that exactly. Remind the diabetic patient. So we now come back here and write the words. Let me just write DM, but you should write in full. That I cannot write with this pen here. So just write diabetic mellitus here. All right, the next thing now, number 10 says, what complication can a patient suffer from if NF isn't treated quickly enough? That sounds like a general knowledge, right? What complication can a patient suffer from? So, I mean, we didn't see anything like complication in our text C and D, right? I don't think it should be in B. It's not. So let's go back to A. So another thing is this text A gives you a general knowledge, okay? Understand this, the general information about the disease condition, right? Like I see, it was about what?
Septic shock.
Shock.
Okay, somebody says septic shock. We are going to look for the answer together. So text A gives you a general knowledge, right, about what the disease condition. Like I said, nicotine fasciitis. Or when I say it might be a definition, it might be anything. So by the time you now figure out that your text B was about medication or drugs, text C was about what was text C about? Say, text C was about supportive care in ICU. Then D is about advice to give a patient, right? So we now read text A again. Then the nicotine fasciitis, infection. As the infection progresses, can you see from here?
Yes.
The infection progresses rapidly, quickly, okay?
Yeah.
And septic shock may ensue. And septic shock may ensue. That's a complication, right?
Yeah. Yes.
Like when disease progresses rapidly, septic shock will ensue. So the answer is what? Septic shock. So we come back here and provide our answers as what? Septic shock. Just write it here, septic. Shock. It can't be operated on.
Is a VAC?
Vacuum,
I think is it vacuum whatever.
vacuum dressing.
Vacuum is not vacuum dressing. It's vacuum.
Yes, VAC.
VAC is VAC is in C.
Vacuum something.
Yes.
Somebody is saying vacuum something. That should be
Yes.
under where we had our wound care, right?
Yes.
So let's come back and check. Wound care. We
No,
underline here.
vacuum assisted.
Okay.
Vacuum assisted closure. Vacuum assisted closure.
Okay. Vascular closure was recently reported to be effective in a patient whose cardiac status was too precarious to undergo a long surgical reconstruction operation, right?
Yes.
So the answer is what? Vacuum assisted closure. I love the fact that we are catching this real quick. So is what is vacuum assisted closure? You right? Provide your answer here, right? Now
Yes,
we
sir.
move to 15. So 15 says the average proportion of patients who die as a result of contracting NF. So proportion talks about what percentage, right?
Yeah, it's in 8.2%.
Okay, who die mortality. Remember that we saw the word mortality before.
Yes.
So we are looking for what a number.
Yes.
Most likely this answer is going to be what a numerical what formation divided on this text. Where you say text. Somebody is saying we have numbers in text A. All right. Okay, I can see 32.2% here. Okay, proportion percentage. But let's read out again.
The mortality rate.
Okay, so the mortality rate, the proportion, okay, the average proportion, mortality rate is high. And now in bracket, median mortality. Median simply means what? Average. Right? So now the answer is 32.2%. You just come back here. And please, when you're providing your answer, read the question again where it makes sense to you. Okay? So you come back here and write average proportion of patients who die as a result of contacting NFE is what? You write 32.2%. Pardon my writing. 0.2. Okay, 32.2. 32.2%. All right. Now, since there's patients who have eaten dash may be infected with Aeromonas hydrophilia. At some point, we saw the pathogen Aeromonas, right?
In A.
That's B.
Somebody saying B. Somebody saying A. What does B talk about, please?
B talks about
medication. It doesn't talk about what to really eat, right? It talks about medication for treatment. Okay.
Yes.
Even though the pathogens I mentioned here, But don't forget that we saw another place that pathogens were mentioned, right? Which was what in the table in text A. So now the keyword we are looking for is what? Aeromonas hydrophilia. That is the organism or the pathogen that is being mentioned in the question, right? So I'll come down here to where we have the pathogens and run down I to where we have what? Aeromonas hydrophilia. So we have Aeromonas hydrophilia, okay, in what under type 3.
Type 3.
Now look to your left, look to your right, okay, and look for what someone must consume. Which food is mentioned, right?
Seafood.
Okay, so coming down here, you can see seafood consumption for Aeromonas. So what the answer is what? Seafood.
Seafood.
Okay, you just underline here, seafood. Just come back, provide your answer as what? Seafood. So our answer here is what? Patient who have eaten seafood. Can you see that?
Yes.
Maybe infected with Aeromonas hydrophilia. Now, the next thing is patients with type 2 infection usually present with infected what? Okay, it sounds like
the same
impacts.
test A.
Okay, so now looking for what? Type 2. Okay, sorry. Type 2 patients are infected with what? So we are back here. Type 2 patients. Okay, we have seen type 2. Okay, which is what in bracket monomicrobials. Okay, beta. This is the what? The
Beta
pathogen.
hemolytic streptococcus. Streptococcus.
Hold on. Is that the answer?
No, I think the answer. Please, let's go back to the question again. I don't
Let's
know.
go back to the question again.
Yes.
Answer. Please read the question again.
Patient is the limb. Patient is limb.
Yeah. Yes, infected limbs. Streptococcus.
Okay, presented with
Usually present with infected limbs.
Can you now see that the question is asking, not asking about the pathogen.
Yes.
It's asking about the part of the body.
Part of the body.
Right.
Okay. The size.
Infected limb.
Exactly. So now the answer here is what? Is limbs. Can you now see that when we were skimming through, we also underlined the word limbs.
Yes.
All right. So that's mean this strategy is what is working. And you also said to me that we are about to answer 20 questions without reading this text, true or false. We have not read to know the contents of text, what this passage talks about. It's not our business. We are going there we are going to pass exams, pass a test. So the passing is our business. When we are out of that phase, we can go online and find journals for necrotizing fasciitis and read for our knowledge. But on your test day, you're not going to go and read for anything. You're not going to go and gather knowledge. You're going to go and pass your test. Okay. By so doing, you're coming out with nothing less than 400 to 450. Okay. Because by the time you're done answering 20/20 and you go to your text B, okay, and then by the time you go to your text your reading part B and reading part C, it might be a little bit difficult. So when you get there, just make sure that you're coming back with what your pass rate, okay, with your good scores, with a very good pass rate and good scores. So we're looking what we're going to be looking at your next question, which is what 18. It says type 1 NF is also known as. Where are we going to?
Test A.
In addition, to paraphrase that, it talks about what's the another name for type 1 NF, right?
Text A.
So what's another name for type 1 NF?
Yeah. That's
Polymicrobial.
Polymicrobial.
Can you see this? Exactly. Exactly, you're right. So type 1 in bracket, polymicrobial, right? That's your answer. And you just move. You come back here and provide your answer as what? Microbials. Yeah. 19 says the patient needs to be aware of the need to keep glycated hemoglobin levels lower than what? Which text talks about
it? Should be type 4. Text D.
Text D, right?
SD, advice.
Yes.
D, yes. Under the
Okay.
remind
So
diabetic.
all right, the answer sounds like what in numerical going to be a numerical information, right?
Yeah, yes.
So let's look for reading types.
Type D. Text D.
Okay, text D,
Lower than
right?
7. Yes, I remember that.
Okay, can you see?
Under
Someone
the
says,
diabetic patients. Remind the
oh,
diabetic patients so that it's keeping the
okay.
growth.
So they can see
7%.
7%.
7%.
Now, right. So when you get the answer, go back and read the question so that when you put the answer in that question, whether it will make sense. So let's come back and see whether it's 7% that is the answer. Now I said the patient needs to be. Someone is saying something else. Somebody said,
sorry.
okay, the question is the patient needs to be aware of the need to keep glycated hemoglobin levels lower than what 7%.
7%.
Please, the answer is not 7% or less, it's just 7%. So you write your 7% here.
Yeah.
Now, number 20 says the patient will need a course of dash to regain fitness. A course of what to regain fitness levels after returning home, right? That talks about when the patient takes what?
Discharge.
It should be
Discharge,
D,
right?
D.
Right.
Text D. Yeah.
So can somebody give me what patient, the course of what patient will need to regain strength?
Physical therapy. Physical therapy
Social.
session.
Okay, you're correct. She's right. Physical therapy.
Therapy to rebuild this strength.
Yeah.
Are you saying physical therapy? Let me highlight it for you, or for us rather.
Physical health.
Say physical therapy sessions to rebuild strength.
How many words?
Okay, so the answer is what? Physical therapy.
Therapy, because
all right.
This already caused there now.
All right. So the answer is what? Physical therapy.
Therapy.
No, it's not physical therapy sessions. A course. No. That course. Sessions cancel that course. All right. Yeah. Patient will need a course of that sessions of physical therapy to regain fitness after returning home. So at this point in time, I don't know. I'd like to say before I say thank you, I would like to take questions from anyone. If you have questions, please go ahead. And if possible, you can use the hand raising icon so that I can call you to speak. You need some clarity.
So
okay, please go ahead, please.
Thank you very much for this session. So my worry is this scanning, this zigzag scanning. How? Because you said 15 seconds, right? 30 seconds.
Yes.
But I'm just worried that it may take longer considering the way you did it. For, I don't know, probably because one is still new.
It was explaining.
Okay, the reason why I did that way was to make sure that I carry everybody along. So you are said to me that not everybody learn at the same pace. Okay? But then when you are trying to teach people, you have to actually take it slowly, okay, to make them understand how it works. After they understand how it works, they can now apply speed. You understand? The first thing is to get it right first on what to do, and then to know how to do it. All right, thank you. Hope I've answered your question, right?
Yes, thank you very much.
Okay, so I can see a hand from Dr. Adeshino. Can go ahead, please.
Okay, the question I want to ask, like in case of that glycolated hemoglobin, although it was written in the text 7%, like you said, one can use home memory. If I know maybe the value is less than 6.5, can I quote it? Or like in case of that physical therapy, can I say physiotherapy? Will it be the same thing or will it be wrong? That's my question.
No, please, it should be.
Answers are expected to be lifted directly.
So I said you have to provide the answers the way they are in the text, please. Okay.
Okay. Okay, sir.
Please, just the way they are, please.
Okay.
That's why I
Okay.
said if you write 7% or less, you'll be wrong.
Okay. I get the point, sir. Okay. Yes.
Thank you. Is there any other hand, or you can just open your mic? If you can't find the hand raising icon, you can just open your mic and ask your question. Olasha, did you have questions for me tonight?
No.
Okay. Any other question?
Yes, please.
Okay, go ahead. Go ahead, please.
Thank you for the. It's about the skimming.
Please, can you be a little bit audible? Go ahead.
Hello, can you hear
Go
me
ahead,
now?
please. Yes, I can hear you, Zainab.
Okay, it's about the skimming method, right?
Okay.
I'm still a little bit confused about the zigzag method because I'm used to reading from left to right, and you said that is not advisable in this part of the section. So how do I really? I really didn't get your explanation on the zigzag thing.
Okay, Zainab, thank you so much for your question. Now, this is how to pass OET Reading Part A. Okay, I know that all your life you'll be reading from one point, okay, in a particular line from the beginning to the end, okay, and now you were reading that to understand and to get an in-depth of what the passage or the text is about, true or false. Now, don't worry yourself, okay. Keep that skills. It's required of you in your text B and C. By the time you get to those paragraphs in text B and C, sincerely, it will be required of you. Okay. Now, this is what you do. Now, the way OET reading part A is designed is for you as a professional, healthcare professional, is that by the time you are at emergency department or a patient is brought in, okay, as an emergency, you can quickly flip through and skim through the patient's case notes, okay, or a referral letter that was sent to you, okay, just skim through and know what's wrong with the patient. So it is a skill you are going to develop. Like I said in the beginning, that it's a skimming skill that we must develop, okay. I know that to be very frank with you, if you start, you realize that maybe your first time starting, you might be answering, let's say, might completing answering the 20 questions, okay, in 20 minutes for the first time. Okay, that's good. Okay, everything has what? The more you practice, okay, the more your accuracy will increase, okay, and then the less time you spend. So the more you practice, the less time you spend in answering these 20 questions, and the more your accuracy increases. So you must find a way to just skim through, just quickly run your eye from one point from the left to one another point on the right. I think, let me just go through this again for us. So this is what I meant, Zenab. So if you look at this, for example, let's look at text C, right? So we highlighted supportive K in ICU, right? Next thing, we saw wound K, underline caloric intake, underline intravenous hyperalimentation. You're looking for keywords, right? Remember that I said in the beginning somewhere here, I said you should look out for what? Graphic elements, right? Tables, graphs. You see it's a graph. Check what is plotted against what. Do you understand? Check what is on the y-axis, what's on the x-axis, okay? What are those things that are noticeable on the graph, okay? What are those points, okay, on the graph, okay? Another thing is this, look for footnotes, look for bullet points, look for numerical information. You have seen how useful numerical information has been, okay, for this particular text that we were discussing today in this class. So it's a skill you have to develop, okay? You must just develop that skill, save your energy of reading, because if you start reading from one point to another, sincerely, you will not finish this today. And that 15 minutes will not be enough for you to answer 3 questions. You want to read everything, right? And you can as well see that we apply these skills but we not read any of these texts, but we got the answers correctly. So that's how it's been designed. Okay.
Okay, thank you very much.
All right, you're welcome. So I need more questions, please.
Yeah, good
More
evening,
Good
Dr.
evening,
Isio.
Tosin. Yes, go ahead, please.
Yeah, I just want to ask if it would be possible to have this recording after this class so that,
Yes, I will
by
share
the
it.
time.
Yes, yes, call it down, please.
Okay, thank you very much.
You're welcome. So any other question? Tosin, do you have a question for us tonight?
No.
Okay, so I'll just give like, let's say 15 seconds. If I don't see any hand, I'll start appreciating everyone who attended the class. Before then, thank you, Additional. Thank you, Chineyenwa. Thank you, Chooks. Thank you, Doris. Thank you, Efemena. Thank you, Ekome, Faith, Folafumi, Folashade, Funke, History, Joy, Rebecca, Ruth, Taiwo, Tosin, and Zenab. Thank you all for finding time to join us, okay? To join this class. And I want to wish you all a wonderful night rest, depending on your time zone. So take care of yourself and bye for now.
Thank you.
Bye.
Thank you, sir.
Welcome.
Thank you.
Welcome.
Thank you.
Thank you, and you too.
Welcome.